Knock knock.
Come in.
Hand sanitizer. Hi, my name is Jovanny. I'm going to be your nurse today. We're going to be performing an assessment. I see you have some visitors here. Did you want them to step outside for about half an hour so we can finish the assessment?
No, they could stay.
You can stay? Okay, great. I do notice that there's a little bit of clutter in the room, but that's not a problem. I'm gonna go ahead and take care of that, okay?
Okay.
Alright. And let's go ahead and get started with your first and last name, but I do need your wristband, okay? Just to confirm.
Mary Ibarra,
Okay, can I get your date of birth?
October.
Alright, wonderful. Thank you so much. I am going to go ahead and confirm that with the computer, and let's go ahead and get started. I do have a couple of questions that I have to ask. And do you know where you're at right now?
Yes.
Do you know the date and time?
Yes. April 21st, 10 o'clock.
Alright, great. So her speech is coherent and clear. Her her airway is clear, and her respirations are unlabored. So I'm going to go ahead and take your vital signs at this point. I'm going to put a blood pressure cuff on your arm. While that's running, I'm going to check your pulse here. Alright, your respirations are 14, your pulse was 92, your blood pressure was 108/62, and your temperature was 98.7. Last time it was 108/60, your pulse was 90, last time your respirations were 16, and your temperature was 98.6, and both times your O2 saturations were 99. That means you're oxygenating your blood, and everything turned out normal as far as your vital signs. Do you have any allergies to medication?
No.
Okay. And do you have any pain today?
No.
No? Okay. Wonderful. Let's go ahead and move on. I'm going to go ahead and test both your arms here. Okay. Both your pulses on your arms are 2+ in strength. Your arms and both your arms are warm to the touch. They're pink. I'm going to check for circulation on your hands. Capillary reflex is less than 2 seconds. There's no scars or cuts on the arms. Let's go ahead and check your motion here. So what I want you to do is I want you to lift your arm. I want you to now bring it down. Bring your elbows in. Bring them out. Bring your wrists in. Bring it out. Okay, good. And I'm gonna actually, we're gonna actually push towards me. Okay. Push up. Push out. Push in. Now push out and push in. Same thing for this one. Okay. Push down. Push up. Push out. Okay. Push out again. Push in. Okay, great. And have you had any tingling on your arms or your fingers? Any numbness?
No.
Have you had any weakness at all?
No.
Okay, wonderful. Have you had any trouble swallowing at all?
No.
Okay, great. So let's go ahead and move on. I'm gonna go ahead and check your mouth and your face and your eyes. I did notice that you did have a IV line on your right arm. So I did trace it back, and it is patent. It is unkinked. It is running at 4 milliliters an hour of normal saline with the medication that the doctor has prescribed. So that is still going. And let's go ahead and check we're gonna check your face for symmetry. Go ahead and smile. Go ahead and close your eyes and open your eyes. Okay, great. And then let's go ahead and view your eyes here. Look at me. Okay, great. Alright. And I'm going to go ahead and have you look at this pen. Alright, look at the wall behind you. Okay, great. So it's Perla, and her eyes did constrict as I put the light. Let's go ahead and look at your mouth here. Open. Stick your tongue out. Alright, everything looks pink and moist in there. Tonsils don't look inflamed. Her teeth look intact. She has all her teeth. She has a few cavities. And let's go ahead and check your breathing now. So I want you to take one deep breath. Alright. So there's no problem with her breathing. She has a symmetrical expansion. So go ahead and lean forward just a little bit. So breathe in and out, okay? Good. Okay. Breathe in and out. Good. Okay, now we're going to check the front, okay? Okay, let's go ahead and check your heart now. Alright, Herb's point. Now we're at the apex. So I would check the apex for a minute if she's on digoxin or if the provider ordered it. So now I'm gonna go ahead and check your abdomen. So go ahead and lay down on the ground. Have you had any chest pain or any trouble breathing at all at any time?
No.
Okay, great. Let's go ahead and lift your shirt up to your ribs right here. Alright. I'm going to go ahead and check your abdomen here. It's nice and flat. There's no distension. I'm going to go ahead and listen to your stomach sounds. Alright. Stomach sounds are normal active. I'm going to go ahead and, have you had any pain at all in your stomach? Okay, I'm going to palpate lightly, okay? Any pain?
No.
Okay, I'm going to palpate deeper now. It's a little distended on the front, on the suprapubic region. Other than that, there is no pulsations, no masses. Now we're going to go ahead and check your legs. I'm going to check your pedal pulses. Alright. Now let's go ahead and check your circulation on the feet. Her skin is warm to the touch. Her legs are nice and pink. Let's go ahead and check the motion. Now I'm going to have you bend your knee up, bend your hip. Alright. Okay, bring this one down, bring this one up. Bend your hip. Bring it up. Now I want you to push against me, okay? Push against me. Good. Alright, good. Up. Push against me. There you go. Down. Alright, bring this leg down. Push against me here. Push against me. Good, 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 good. Alright. Any tingling at all in your legs?
No.
Any numbness?
No.
Any weakness? Alright. I'm going to go ahead and I've inspected almost all your body. I just want to look at your back to make sure there's no pressure points, pressure ulcers, okay? So I'm going to go ahead and lean you over. Alright, you're clear. So her body is warm, pink, symmetrical all around. There is no ulcers, no cuts, bruises. I do want to check for edema here. She's negative for edema on her arms and her legs. And We did check for turgor. So I just want to know overall, how have they been treating you here at the facility here at the hospital?
Really good.
Really good. Okay, and she didn't have any drainages, any surgical incisions, but I would check for infection. I would check for the surgical site and make sure that we are draining still. Thank you.